Hi, my name is Daisy and I'm reporting for my client Rocio Ortiz. She's an 8-year-old female, Hispanic. So a little bit about my client is she currently lives with her biological mother and half sister. Her sister comes from the same mother, different father. Lives with their 18-year-old cousin as well from mother's side and mother's boyfriend in a 3-bedroom house apartment. My client's mother and father separated about 3 years ago and are in the process of divorce. My client's father was forced to leave during the separation and moved into an apartment complex nearby. My client's mother reported that they had been growing apart for a while, but they forced the relationship to work to keep the family together. Per client's mother, client has had a good relationship with cousin and younger sister, and she is close to both of them. The father and mother's boyfriend do not communicate often, only when necessary. When they do, it's always respectful. Client's mother said her relationship with her child is great, but the divorce is really beginning to affect her. Client realizes her parents are really not getting back together, and with the bullying at school, she's beginning to show more frequency in withdrawals from school and home. Per client's mother, client is actively involved with family activities, but as of a few weeks ago, she has begun to cry much more. This began when client's father took her to a friend's funeral. Around this time, client was already dealing with the news of the divorce and being bullied for peers. Client's mother stated that all of this could potentially be too overwhelming for her to process, and the family is not concerned because she's beginning to socialize less. As we continue on, I was able to also obtain more information regarding the fact that client has not endured any sexual, physical, emotional abuse or trauma. Client has not engaged in any previous or current self-injurious behavior, has no past or current suicide ideations or history of suicide attempts. Client has never attempted to harm anyone else and does not have any current or past homicidal ideation. She has not been exposed to any family violence or personal acts of violence, no history of substance abuse. Client has not displayed any abnormalities in her sleep patterns or appetite. Appetite remains normal. She has expressed some body concerns. She does feel she is overweight and wants to join swimming classes. However, client's general health is poor. She's been diagnosed with diabetes. She has to take medications, which mother couldn't remember at the time what the name of them were. So I'll have to follow up. Client does not participate in any cultural healing practices. Client or family has not received any prior counseling. Nobody in the family or the client has ever been hospitalized. There's no mental history to their knowledge. Client's family isn't very close to the extended family. No one is in the family has taken any medication for mental health issues. Some concerns though is that the client is having difficulty adjusting to parents divorcing due to adjusting to different parenting styles. As such, client struggles with transitioning between parents' homes. At the same time, client is being rejected and bullied by peers for her excessive weight. Client stated that she has diabetes, and because of this, peers continuously taunt her over it. Client's father mentioned a recent passing of one of his close friends. Apparently, the client had accompanied father to the funeral, and since then has had frequent outbursts and uncontrolling behavior, such as crying. So, for our treatment plan, we did the SMART. We began with she wanted to build her self-esteem and comply with mother more, wants to be more confident in herself and make life less troubling for mother. So as such, we will observe, self-report, and produce collateral report to make sure client is maintaining all this. Client will increase listening to mother from 2 times a day to 5 times a day for the next 2 months. Client will also increase positive interactions from 2 times a week to 6 times a week for the next 2 months. The goal here is worthwhile and timely. It seems the client is experiencing other factors that contribute to her lower self-esteem, her nutritionist referral, and difficulty transitioning from parenting styles that are motivating her to complete these goals. The goal will be, as mentioned, measured for 2 months. The assessment has been completed and goals were established. As of the following week, and our first session goals have begun and have been worked on. This was followed up with bi-weekly check-ins and sitting in classes with teachers and parents. Anything else? Client is doing well. Client has reached most of her goals, and we have now we're now in the middle of our exceeded amount of sessions. Thank you.